The purpose of this presentation is to provide the radiographer with a brief overview of how a digital radiograph is processed and the steps the image takes from the time of order to when it is posted to the PACS system. Whether using a CR or DR radiography system, a few steps must be taken to prepare for the exam. We greet the patient and confirm their identity, have them remove any apparel that might interfere with the exam, have the patient don a gown if necessary. While the patient prepares for the exam, now is the time to prepare for the exam room. If you are using a CR system, gather the imaging cassettes needed to complete the exam, one plate per view. If possible, this is a good time to mark the cassettes and associate them with the patient and view that the cassette will contain. For a DR system, now is the time to call up the patient's information screen and link the patient's information to the views of the exam. For both systems, it's important to identify each view in the exam to the view's metadata so that the view is properly processed by the computer. With the patient prepped and the exam room ready, perform the examination. If using a CR system, make sure the cassette holds the correct image, and if a DR system, assure that the image that is captured is properly identified. For a CR system, it is now time to have the PSP plates scanned. For a DR system, the imaging plate is automatically scanned and the image stored in the computer memory between each image acquisition. As each image is acquired, it must be corrected because the raw image is not viewable by the human eye. First, the image must be located and the data stream coming from the plate. This is normally accomplished by finding the collimator borders. Using tight collimation assures that only data that is important to the image are used to correct the image. Once the image is located, the computer uses the histogram, the lookup table, and image filters to correct the density and contrast of the final image. The final image is presented to the radiographer, who evaluates the image for positioning and exposure factors. At this time, the radiographer decides to repeat the image, modify the image, or send the image to PACS for the radiologist to read. It is important that any digital manipulation performed on the image be documented as part of exam notes or as part of the image itself. When the image is approved, it is sent to the PACS server for storage and interpretation by the radiologist. Additionally, the image on the PACS server is available to other hospital personnel to aid in patient care. This is a quick overview of the important steps involved in processing a radiographic image. The patient is identified, and the system and the patient parameters are appended to the metadata of the view. An ideal histogram is called from data and may be used to correct the image once captured. In this case, the adult lateral skull histogram is selected. The ideal histogram and the lateral skull correction factors are stored in memory and will be used to correct the image later on. The exam is completed and the image is captured on the imaging plate. The imaging plate is scanned by the computer and image stored in memory in the case of a DR system, or by the plate reader and subsequently sent to the computer in the case of a CR system. The image is now ready to be corrected by the computer. Some systems may briefly display the uncorrected image and then reveal the corrected image. Others will only display the corrected image. My system will illustrate all correction steps. The first step in correction is finding the pixels that contain relevant image data. For the lateral skull, the adult skull can be easily contained in a landscape-oriented 10 by 12 inch radiation field. The computer searches the data coming from the capture media for collimation borders. Pixels inside the border are used to implement correction. Pixels outside the border are ignored. Poorly collimated images will display inferior results. With the image located, we're now ready to correct density and contrast. Using the pixels inside the collimated area, the computer generates an image histogram. The image histogram is compared to the ideal histogram. The lookup table applied, various filters and image densities are corrected. Masking is applied to the outside the image area. Masking is an artificial black border that covers the white border outside the collimated margins. Masking is applied as eye strain for the radiologist. Some systems may provide an option to display a 1 or 2 pixel white border between the image and the mask as a visual indicator of proper collimation. Now is the time to evaluate the image for correct exposure and positioning. Is the image acceptable? The answer is yes. And the image is sent to PACS. It is important to remember that you must document any image manipulation performed, no matter how small, on the image before submitting to PACS. You don't want to be accused of trying to hide shoddy work by post-processing the image. There is metadata attached to every image you produce in the form of a DICOM header. The DICOM header may contain not only patient information, like the patient's name and exam date, but also study data such as collimator size, central ray location, KVP, and MAS used to produce the image. This will end my presentation. Thank you for your attention.